and hair health. And we are going to give you some pointers so you can determine if clients' hair is healthy enough to support the extensions. So, first, I want to say that hair loss is so common, and it is one of the main concerns that women have, and one of the main reasons why women are coming in to most of the time receive an extension service. So, thinning hair or hair loss can be caused by so many things, and it can take 3 to 9 months for someone to actually notice that their hair is thinning. So, some common causes of hair loss are age, stress, medication, poor diet, which goes along with not having the right nutrients in your body, hormonal change, overstyling, some diseases, physical trauma, and genetics, surgery, and pregnancy. These are all reasons why somebody could be experiencing a major amount of hair loss. So, when it comes to talking about medication, this is so important to discuss with your client. Some medications are not really great to somebody who wants to wear extensions. And the reason why is some medications can actually cause your hair to shed 30 to 70% more than normal. And that is a lot. So, if you have somebody who is on a medication that's causing their hair to shed, then that can lead to the extensions essentially not really lasting as long as they should, or the hair and the bead falling out, which can create more tension because there's not enough weight to support the wefts of the hair. So, we want to talk about the normal cycle of hair growth. So there are different cycles of hair growth. In the anagen phase, which lasts 2 to 7 years, the hair is in the actual stage of growing. And then in the telogen phase, I don't know if I'm saying that right, which lasts about 3 months, this is when the hair rests. At the end of this phase, this is when the hair is actually replaced by a new hair. So that's when you're having your normal shedding. It's between 100 and 150 hairs a day. But the most common form of drug-induced hair loss is actually caused by telogen effluvium. I don't even know if I said that correctly, but that is what causes drug-induced hair loss. So it usually appears 2 to 4 months after taking a specific prescription drug, and the condition actually causes the hair follicle to go into the resting phase and fall out too early. So when you're normally in your hair cycle, that's 2 to 7 years. Whereas when you are on certain medications, that 2 to 7 years is cut short. So your hair falls out early. And these people, like I said before, usually shed anywhere from 30 to 70% more than normal. So if your normal hair loss is 100 strands a day, somebody who has the extreme version of this is going to have up to 700 hairs a day shedding, which can be very scary for a lot of clients. So next I want to go into talking about rejection. So rejection is when the scalp releases the hair follicle due to tension or stress. So your body considers hair a non-essential function. And when your body is going through stress, when your hair follicle is going through stress, it will actually be rejected because of these issues. So your body will let go of the hair so it can utilize the resources for what the body actually needs. So your scalp has so many nerve endings, and it's so sensitive, and there's extra nerve endings in certain areas. So in the nape of in the nape area, there's extra nerve endings there. And then of course, all throughout the head. So you want to make sure so you don't cause traction alopecia on somebody. That's when the hair is actually pulled out of the follicle due to tension. that can definitely cause permanent damage. And this is why really making sure that you're doing a proper consultation is important. Placement is important because you don't want to hit those areas that have all of those extra nerve endings. Your application has to be perfect so you're not creating any unnecessary tension. You really want to make sure you're checking the follicle because somebody with a weak follicle is not going to be able to support the weight or the tension on the hair that is created from extensions. And then, of course, you want to make sure that the client knows how to care for the hair at home because a lot of people don't understand the extra tension they can cause by brushing, pulling their hair up too tight, doing too tight of a braid. I mean, there's so many things that can cause excess tension when it comes to at-home care. So, like I had said previously, the scalp has a lot of nerve endings. When the scalp is stressed, it can cause rejection. This is when the scalp releases the hair due to stress and tension. So, you have to do a pull test, and when you do your pull test, you want to use a little force. So, when we're doing a pull test, we are checking for shedding. And we're going to take about a section that's the size of the bead you're going to use. You want to check in two areas. So you want to check on the side of the head and you want to check in the nape area. And you want to pull 3 times. Now, the reason for a pull test is this is gonna show you if their follicle is strong enough to withstand the weight of the extensions. So when you're doing your pull test, you wanna make sure that you really look at how many strands come out when you pull. Now, when you're doing your pull test, density matters. Somebody who has finer hair, obviously, and has more finer hair, they may have more hair that is shedded. If someone has more of a coarse texture, again, they may have less. So 1 to 3 strands is normal for a pull test. If more strands come out than 3, I would definitely proceed with caution and I would, of course, check another area, but you really want to make sure that you are checking the strength of the follicle. So you want to make sure you're also testing anywhere where the extensions will be attached to the scalp. So you want to make sure that we're checking scalp health. We're looking for any areas that look like there could be any inflammation. You want to check to make sure that they don't have any like skin conditions like psoriasis or dandruff because the extensions can definitely cause irritation, especially when they're freshly placed. Again, you want to check in the areas where the extensions are going to be attached. You want to check and make sure it's the same section size as the bead. And you also want to make sure you're doing a stress test. So when we are checking the scalp, we're also checking for scalp elasticity. We want to make sure that there's movement on the scalp, that, when you're tugging on the extensions, that there is movement in that scalp so it doesn't create extra tension on the client's head. So thank you so much for learning today. I hope today was helpful. Scalp health is so important, and it's something that you should absolutely do with every single guest that's coming and sitting in your chair.